Hi there, I'm Erin of Fully Alive Families, and welcome to our Avoiding Antibiotics series. This is the first video on wound care. We're actually going to have 3 wound care videos. The first is just basic wound care. Video number 2 is the whole body things that you need to be doing if you are struggling to heal a wound or if a wound is infected and you're having trouble kicking the infection. So this would include difficult things like MRSA or cellulitis. And then the last video is kind of the topical treatments for infected wounds, everything from the wound that your son got on a backpacking trip and you are only looking at it 4 days later once there's pus everywhere, to MRSA boils, to bed sores, all those things. Because the reality is, if you are fully alive, you're going to be getting wounds. Outdoor adventures, animal care, roughhousing, cooking, all of it causes wounds. And if you're struggling to feel fully alive, maybe you have nicotine addiction, obesity, diabetes, other complicating factors, all of those things can lead to slow wound healing. So at the end of the day, wounds are just part and parcel of our life. So let's just dive in with basic wound care here. So rule number 1 with a wound is just to clean it well. If you can clean that wound well, you are well on your way to healing. Wound cleaning is just called irrigation, and the ideal thing to use for wound irrigation is normal saline solution. This is nothing fancy. It's actually just salt water with the correct ratio of water to salt, and it's what they would use in a medical setting to irrigate a wound. You can make your own normal saline solution. You need 2 cups of water to 1 teaspoon of salt. I like to just use a pint jar because then I'm not measuring many more things than I have to or dealing with extra clutter. So I just fill up the pint jar with clean body temperature, approximately body temperature, tap water. I stir in my 1 teaspoon of salt, and then I'm ready to clean the wound. You could sterilize water and sterilize a jar and use that, but for most wounds, there's no need. Just clean tap water is just fine. If you have a really dirty wound or a really deep wound, it's helpful to have a little extra force to kind of push out the debris and push out the bacteria. You can use a syringe, not a needle, but just the plastic syringe portion, which you could order online from a medical supplier. And you can suck up your normal saline solution and squirt it on the wound, and that's really helpful. You could also buy a peri bottle from your local pharmacy and put the normal saline solution in there and use that to get some extra force to debride or take the junk out of your wound. And a lot of times you're gonna be in an unideal situation. Maybe you're backpacking or at some park having fun, and you're just gonna need to use the cleanest water available and do the best you can, and then clean it better when you get home. Sometimes you will see a wound and you will just know you are out of your league. It is deep, it is dirty, there's debris stuck in there, the child is hysterical, who knows? But there's no shame in deciding that you're out of your league and going to an urgent care facility and asking them to irrigate the wound. They can do this very effectively. You can still go home afterwards and bandage up the way you like to. You can graciously accept the antibiotic prescription that they'll probably send you home with, and then just make an informed decision about whether or not you want to use it. So going there is not like you're signing up to do everything the Western medicine way. You still have freedom to choose. Wounds that are super dirty or look like they're gonna have a hard time healing, after the initial cleaning, it can be helpful to create an herbal tea. So you could use plantain, you could use calendula, chamomile is also a great option. You could make a strongly brewed herbal tea, let it cool, and then pour it into a bowl and add that same ratio. So like 1 teaspoon of salt to 1 pint of tea. You can always add a little water if you need to adjust the ratio. And then have the person soak the wound in that if you have something that's just gonna need a little extra infection busting power.